Welcome everyone to session 3 of our Workforce TNTA Professional Development Series. First of all, I do want to say I'm actually in the middle of traveling, so if you hear any background noise while I'm speaking, I'm in an event right now in a meeting space. But we're super excited to have everyone here. So today we're going to be talking about compensatory selection. Luckily, you won't have to hear from me for very long. We have Steven Bennett, who is the Director of Workforce Programs at the Florida Association of Community Health Centers. So let's go ahead. I just want to do a few housekeeping slides, and then I'm going to pass it over to Steven. And we also yesterday spoke with Steven. We're very happy to take questions throughout. So if you have any questions, just feel free to put them in the chat and we will make sure to get to them. So this is the wonderful STAR Center team. You have all of our contact information here. I do want to point out Sydney Axelrod. She is our brand new training specialist. So we're very, very excited to have her on board. And if you've been to any of our other trainings, you've probably seen either myself or Helen or Suzanne. And then Mariah is our amazing person who puts all of this together. So if you don't know, we are the Association of Clinicians for the Underserved, or ACU. We were started a little bit over 25 years ago by National Health Service Corps alumni, and as it says here, our focus is that access to care and that clinician support, but we have a lot of different types of programs. We have a Justice, Equity, Diversity, and Inclusion program, a Vision Services program, Suicide Safer Care, but the program that brings us here today is the STAR Center, which is the Solutions Training and Assistance for Recruitment and Retention. And when I go to this slide, what I always like to point out is we are one of the 22 national training and technical assistant partners, and we are funded by the Bureau of Primary Healthcare. So that means that all of our resources, training, and technical assistance are offered for free for health centers. We have our own site, which is right here on this slide. And then this is another way to get in contact with us. This email actually goes directly to me, and then I filter it to the team as appropriate. And then for housekeeping, everybody is going to be getting the recording and the slides after the presentation. Just give us a little bit of time, a few days, and we'll get everything to you. As I mentioned, please go ahead and use the chat box to ask any questions, share comments, give your thoughts. If you are having technical difficulties, please contact Mariah Blake. She will be able to assist you. At the end, we will have an evaluation. We really, really appreciate if you could please fill that out. And we just really always say, please be present as possible, listen deliberately, and share generously. And I see there is something in the chat. Oh, perfect. Yep, it's just Mariah saying, feel free to send her a chat if you need. So we are in the third session. I already talked about a little bit of it at the beginning, but we're going to be talking about compensatory selection. I'm not really going to spend too much on these slides, but just the baseline for everything we do is how critically important it is to invest in your workforce. And this is one of the ways that you can do that. So we also talk about core components of what really makes a high functioning health center. So when we look at what we're going to be talking about, it's really along a lot of data-backed information that we'll be putting forth, and those tested recruitment and retention strategies. And for everything that we present, we always have to put this out here where we say, put it in your comprehensive workforce plan, write it down. It is critically important when you're looking at retention and recruitment, anything workforce related, that you have your comprehensive workforce plan. So without any further ado, I want to go ahead. I'm going to stop sharing my slides and pass it over to Steven Bennett.
Thank you, Michelle. Hi, everybody. It's really great to be with you. So let me get my slides going. And unless I hear otherwise, I'm assuming you can see that. So
yeah, we can see them perfectly.
Perfect. Okay. So thanks for giving up an hour of your day to hear me talk. I'll try and make it as engaging as possible for you. But just such a pleasure to work with the ACU STAR team. It's always nice to be able to to geek out with fellow workforce geeks, and I use that term lovingly. People who sort of live and breathe this and get this. And it's such a good partnership that we have with that team. So really honored to be here. So compensatory selections are topic. That's a really technical and probably the most boring kind of name you could think about for what we're actually talking about. And when we get into it, I think you'll see while it's a bland term, it's pretty good stuff in the workforce arena. So we'll go over compensatory selection. What is it? We're going to compare that with multiple hurdle selection, another technical term, but you're going to recognize both of these if you don't know what these are. Talking about how do we make evidence-based real? That term, we see that everywhere, but how do we make it real? The role in recruitment and retention. It's not just a recruitment process, but can certainly be used in retention. And then my favorite thing that I always am looking for are the so what, right? Okay, all this is good, but then what are the real practical tools and application where we can start to use this? And let me just, reiterate what Michelle said. If you have questions or thoughts or heartburn about anything I'm saying, please don't wait to the end. Throw it up in the chat, and Michelle and team will gladly interrupt. We'll go through that. So as we get into this, let's first imagine a scenario where we have 3 typical candidates, and these candidates are going through a typical hiring process. Okay. So candidate 1, if you think about a generic organization, even a health center, but you can make it broader than that. They've got their application in, they've got a resume and cover letter, they've gone through credential verification, they did a background check, their interview number 1, interview number 2, the reference check. For candidate number 1, all of those things occurred. Cool. All right, candidate number 2, they started the same process. Application, resume, cover letter, credential verification, background check. And then something happened in interview number 1. And what didn't happen from there is interview number 2 or the reference check. Candidate number 3, really not a good situation, did the application, and then something happened with the resume and cover letter, and nothing happened from there. So what does this tell us? With candidate number 1, they appear to fit the mold for an ideal candidate. We had all those green check marks, and they just kept going through the process. Okay. Candidate number 2, at first on paper, appeared to be a good candidate. Everything that we saw on paper looked good. Their resume, their cover letter, their application, things were looking good. But the interview did not go well. So nothing else happened. Candidate number 3, the resume and cover letter, something within that wasn't sufficient enough to forward on. So they stopped. In that process, we can deduce those assumptions, right? Candidate number 1 looks good. Something happened at the interview with candidate number 2. Something happened with the resume, cover letter, candidate number 3. What doesn't this tell us? Well, candidate number 1 appears to be to match everything that we wanted in that interview or in that selection process, right? We had all those green checks. But can we honestly say whether or not job fit has been established for that individual? Candidate number 2, what we don't know from what we went through is, why did the interview go poorly? And what does that tell us about the candidate? Was the candidate nervous? Was the candidate anxious? We don't know. Candidate number 3, what was it about the resume or cover letter that wasn't sufficient? Was there bias at play? Was there something in that resume or cover letter that the initial reviewer said, I'm just not going to forward them on? Well, why? What else did we want to know about that individual that we never got to know? All of this to say, This is the typical way that we often hire people, right? We have a sequence of events and that they have to go through. And if they don't make it, we stop the process. Counter to that, compensatory selection is the process of where we source and hire someone based on a comprehensive full picture view of the candidate. We create what we can call a composite score for the individual. In compensatory selection, no single part of the hiring process is going to eliminate a candidate from consideration. As long as they've met the minimum qualifications, right? That there isn't a single piece that's going to be throwing them out of the process. Instead, we're going to have them go through the whole process to create that composite score or view. When you have a deficiency in one area, you're going to compare that to the qualities that are assessed or expressed in another area. So for example, poor interview skill isn't going to throw someone out if they're just nervous, right? Because they may have, in the other parts of the sourcing process, may have really exceptional scores. What this allows us to do is to use evidence, and the more evidence we have, the more objective it becomes to assess the full qualifications of an individual. And so in this scenario, even though this wasn't a compensatory selection process, the only person that we really had a full view of was number one, because they went through the entire process. We did not get a full view of number two. We got a good view, but we did not get a full view of number two. And we certainly did not get even close to a full view of number three. Why does that matter? Well, what could be revealed in interview number one or interview number two that would have told us more about this candidate? What blocked that person in the resume and cover letter that should that have blocked that person in the first place? Again, we go back to those questions of bias. Was it bias that was at play? Okay. So when we get to compensatory selection, what we start to be able to do is to better understand the person as a whole, right? Not just the one piece, but the person as a whole. What we're used to seeing in the hiring process is what we call multiple hurdle. So a candidate is only going to progress through the hiring process if they successfully pass each hurdle. And those hurdles are what we're used to: the resume and cover letter, the reference check, interviews, assessments. The hurdles are going to occur in sequence as decided by the organization. They get to decide what that sequence is. But once they miss a hurdle, once they can't jump that hurdle, that whole process stops. Now, there are some benefits to multiple hurdle selection, okay? It's an efficient process. You can go through 100 candidates in a really quick way compared to compensatory selection. And it allows for the automation that is really in full force within our HR tracking systems to really be at play here, right? You can really do efficient automation within multiple hurdle selection. But there are some real big limitations to this. So it requires some subjective decision-making about candidates without that full picture view. It eliminates consideration for candidates who may be a good job fit, but struggled with one part of the hiring process. So I'm going to give you two examples, real life examples. And this is before I worked with FQHCs, but still within healthcare. We had an individual come in within this healthcare system who was an incumbent employee, okay? So they had been working at the organization for probably 10 years, but they hadn't had a new job within that 10 years, right? It was the same job. And so they were incredibly nervous, and they were really nervous about the interview. So they had a really bad first interview. But in that process that this organization had set up, the compensatory selection process, they noted, okay, the first interview was really poor, but they had a whole bunch of other data points on that individual, partly because they had been working there, but partly because in that process, they had done assessments first. They had the resume they could look at. They had the references they could look at. So everything else about the candidate looked really, really good, but they just had a bad interview. And what that process allowed the hiring managers to do was to say, we understand why they had a bad interview. They were just nervous. Everything else within this pool of evidence says that they are a good fit. So the individual was progressed on to the interview number 2 and ended up getting the job. The beauty of compensatory selection is it allows for human beings to be imperfect in a process that doesn't like imperfections, right? We're trying to put our best foot forward in that sourcing process, right? We're trying to put the Facebook version of ourselves forward and all of that, but that doesn't always happen. Compensatory selection says, we get that. Let's get a full view of who you are and then make a decision. The second example, which is a little bit more worrisome, but something that we see all the time. So I grew up and lived the first 30 years of my life in Michigan. And if you're from Michigan, you know that the big rivalry is Michigan State, which is where I went, and University of Michigan, which is not where I went. University of Michigan is basically a private school, but with a public label, okay? And it's a fantastic university, right? Everybody knows U of M. But the rivalry is very much big brother, little brother. The rivalry is very much like gets into things of class. And, you know, if you have a U of M degree versus an MSU degree, people can think certain things. We had a hiring manager that had an applicant that had been forwarded to her for review, had gone through the assessments, had gone through all the processes, and the HR team said this person is a good fit. We're going to forward them on to the hiring manager. Well, that applicant had a degree from Michigan State. The hiring manager had a degree from University of Michigan. And while she would never admit it, we could tell from the data, other candidates that had gone through, that she never hired Michigan State graduates. She was only going to hire, well, she would hire people who didn't get a degree from U of M, but if they had a degree from MSU, she wouldn't hire them. What compensatory selection allowed us to do was, because she sent that candidate back and said, not a good fit. What compensatory selection allowed us to do is to go back to her and say, tell us why. Because all the other data says that this person is a good fit for this job. It's not enough as the hiring manager for you to say they just aren't a good fit. We need to know why. And there were some real honest conversations that then took place about her unease with MSU grads, which was totally unfounded and you know, but that was a perfect example of the bias that was occurring. Now, that is relatively benign bias, right, compared to other areas of bias that we see in our country and certainly that we see within hiring. Replace MSU U of M with gender, with race and ethnicity, with religion, with class, right? And you can begin to see where real struggles occur in that process. The beauty of compensatory selection is because you're collecting much more information about a candidate, you are able to remove a lot of that subjective decision-making, in other words, bias, from the decision-making process. You'll never be able to remove it entirely, but you're able to mitigate a whole bunch of it in order to get to that point of making a good decision about job fit with evidence. So let me pause there, just check any questions as I sort of set this up of what we're talking about with compensatory selection.
And Stephen, I don't see any questions in the chat, but as you said, anybody please go ahead and put those questions in the chat. We're happy to jump in and let Stephen know.
Absolutely. Cool. Okay. So our big challenge in workforce when it comes to selection of candidates is this. And now I know I've said our big challenge. I didn't say one of the big challenges. I really think that this is like by far one of our, if not the biggest challenge. The primary pieces of evidence we use today to advance candidates are credentials and work experience. When we are in the process of sourcing candidates for hiring, we depend a lot on credentials and work experience. And where do we get that information? We get it from the resume. We look at that piece of paper, the single page or 2-page document that somebody has spent a lot of time to craft, right? And again, they've put that Facebook version out of something that looks perfect, right? A career that has had no blips. And we focus in on what degrees did they have and what jobs did they have. Now, face value, that seems legitimate, right? That we focus on that. But when we look at the evidence, the two least predictive indicators of job fit are credentials and work experience. When we measure job fit for an individual, and we use some proxies for that, including things like job satisfaction, we go a year out from hire date and we figure out, is this person in the right job, right? That they've been hired for. Is it in fact job fit? When you look at what managers say, when you look at different predictors of job fit, the two least predictive indicators of whether or not someone is going to be a good fit for that job a year out are the two things that we use the most to advance candidates in the first place: credentials and work experience. Why? Well, partly because credentials are, for a lot of jobs, becoming a dime a dozen, right? That you've got lots of people with a 4-year degree, lots of people with advanced degrees. So it's no longer something that separates individuals like it was 20 or 30 years ago. In addition, credentials have little to do with the culture of an organization. They have little to do with the work values of an individual or the work styles of an individual, right? Or the ability of someone to, or the level of someone's stress tolerance, or the ability of someone to show up on time, or the ability of someone to work in a team. Credentials don't give us any information about that kind of thing. Work experience is not a good predictive indicator of job fit, because we all know people that have just sort of skated by in their careers. We all know people that have done 10, 15, 20 years in a job where on paper it's going to look like, wow, they are a consistent worker, right? They've held a job for a long time. They didn't get fired, right? But it doesn't tell us anything about how productive they were. It doesn't tell us anything about their initiative. It doesn't tell us anything about who they are as a worker, right? Just says that they maintained work. Now, does that mean we don't pay attention to credentials or work experience? Of course not, right? Those are part of the whole picture. But what we have to be able to do is to create the system by which we look at indicators that are actually going to be indicative of job fit a year out. So we have to start looking at things beyond credentials and work experience. All of this to say, when we talk about job fit, what we're trying to do is we're trying to hire for the person, not the credential. We're hiring for the person, not their credential. We want to know who that person is relative to the job, relative to the organization. We want to know, how are they going to fit in the culture? How are they going to fit in the team? What does their initiative look like? What does their drive look like? Okay. We want to know much more than just Did they get the degree? Did they get the credential that is one qualification for that job? To be able to do that, we need evidence-based tools, okay, to assess that job fit. And we need to understand that when we know more about a candidate, we make better decisions in hiring. We went through a phase in workforce. It's less now, but we went through a phase in workforce really in the 90s and the 2000s, a little bit into the 2010s, where employers were reluctant to know too much about an individual because they were fearful that the more they knew about that individual, the more that was revealed, the more risk they took for allegations of discrimination in hiring, right? So we don't want to know anything about them other than the bare minimum so that no one can come back and say, well, they didn't get hired because of this. And that was an overcorrection, right? And so what we're moving to now is to make sure that we know what we need to know about an individual. People are right. We don't want to know or ask about things that are none of our business, that have no place in someone's work life, right? Their family status, their age, all that stuff has no bearing on individuals fit for a job. But we do want to know, how do they work in a team? We do want to know their level of openness, their level of agreeableness, their level of being able to be in an independent situation versus not wanting that situation, right? Those are all things that are really important to know about a job. We call this the big five that we really want to know about, the big five personality traits. So if you've ever taken a class in industrial psychology, you'll have seen these big five. You can think of the acronym OCEAN to help you remember this. So starting with not in order that they're listed here, but the OCEAN acronym, their openness to experience, their conscientiousness, right? Paying attention to detail, their extroversion, right? Their ability to interact with others, their agreeableness. And then, you know, people smarter than me came up with this. So I always think this is just a weird term, but their neuroticism, their level of neuroticism. Those are the big five personality traits, right? That you can use to describe people. And then there's a whole bunch of more detail within those. Now, do we want every single person to be off the charts in all five of those areas? Absolutely not, right? So I always think of the concept of agreeableness. If you are hiring an accountant or an internal auditor within your organization, you do not want somebody that has a high level of agreeableness, because you want something that believes nothing except for what a receipt says, right? You want an auditor or an accountant to trust but verify, right? So if they have a high level of agreeableness, that's probably not a good match for their job, right? They don't believe anything unless the receipt says that that's what you spent your money on. So it's not to say that we want everybody to be off the charts on all of these measures. What we want to understand is, what do these measures or what do these levels measure to for the individual? And then we match that to the job. All right. So Michelle and I were talking yesterday, and we both sort of chuckled about this term evidence-based because we see it everywhere. It's kind of like the term AI, artificial intelligence, that everything is now AI when it's probably not, right? Like, you know, I remember when smartphones came out, then they started to make everything smart. You could have a smart fridge and a smart toaster. I was like, come on, let's not abuse the term. So evidence-based is one of those terms that is used over and over and over. So how do we make it real? Okay. With compensatory selection, we make it real. So if we think of a hiring process, a typical hiring process, let's think about the evidence that becomes real, becomes evident. So in a resume and cover letter, you get work history, you get credentials. Cool. Very good stuff to know. Your first round interview, you're going to get basic qualifications. You're going to get some historical analysis from that individual. So you're going to get some both objective and subjective pieces of evidence. And in interview number 2, you're going to go deeper, right, with that person. You're going to start to uncover work styles and work values. When you get into a reference check, you're going to get more work styles, more work values that are apparent for that individual. And when you get into assessments, which we're going to talk about, you begin to understand job fit as a whole. So what compensatory selection allows us to do is to get a whole list of evidence, pieces of evidence about that individual. Now, here is where this becomes valuable. Let's think about the two pieces or the two processes or mechanisms for hiring that we've talked about: multiple hurdle and compensatory. So in multiple hurdle selection, when we look at those three candidates, the first one, we had a whole bunch of evidence, right? We had work history, credential, basic qualifications, work styles, work values, historical examples. For candidate 2, we had less evidence: work history, credential, basic qualifications. Candidate 3, we only got to work history and credentials. So when we talk about evidence-based, multiple hurdle selection is if you follow that process, it requires you to make decisions on less evidence. It requires you to make these important decisions without knowing the full context or the full story of that person. With compensatory selection, all 3 of those individuals, you would have had the same level of evidence. Now, let's give the reviewer in that scenario the benefit of the doubt for candidate number 3 when they threw out the candidate after the resume and cover letter. Let's say there wasn't bias, and let's just say that the resume clearly showed this person wasn't going to be the right person for the job. Well, with compensatory selection, when you have all of the evidence at play, you are that much more confident about making a decision to hire, but you're equally that much more confident about making a decision not to hire. So it gives you the evidence you need, especially when someone challenges those decisions, to be able to say yes or no. This process can be used for both recruitment and retention. It is not just a recruitment tool, which I love about it. We can take what we do in retention or in recruitment and apply it to both retention and advancement. So we can take an incumbent individual and develop a full picture view of them for advancement, for a promotion. We can integrate compensatory selection with career pathway tools, right? This is a perfect alignment with career pathway tools. Gives us the ability to take career pathway strategies, right, where we are helping an individual develop agency on their career and develop exploration tools to be able to say where they want to go. Well, we can incorporate these compensatory selection tools in that process. And one of my favorite things is allowing or building and integrating assessments into the career exploration and advancement strategies. So as you think about this, this is both recruitment and retention both. All right, so enough lecture. Now let's talk about the so what of this, right? Now, what do we do with this? So how do we integrate this into the hiring process? And then what tools are essential? So I think the most underused tool that we have in our toolbox are assessments. And I get why, right? There's some cost associated with it. And there are serious issues of quality associated with assessments. If you are at a health center and you go on the internet and decide to use an assessment that is free of charge and you use that in your hiring process, you will find yourself in court, right? That is the thing that people get sued over for discrimination in hiring by using tools that are not the right tools to be used for hiring decisions. There are a lot of really bad assessments out there. So I get why people are nervous about them, but there are legitimate assessments that help us better understand an individual compared to the specific job that they are going for. The right assessments are going to help measure interest areas, work styles, work values, career skills that are foundational, and their cognitive abilities. Why do we need to know these things? I always go to the example of oral comprehension, right? That's a cognitive ability that can be measured, oral comprehension. And I think about, in the Great Recession, right? 2008, 2009 timeframe, when unemployment was really high. And so employers who were actually still hiring during that time period, they had a vast selection of candidates to be able to hire from. So one of the things that we saw happen during that time period was every job posting that came out said bachelor's degree required, even for jobs that never had ever had that as a qualification. Why? Because employers thought the bachelor's degree is the proxy for a good candidate. So no matter what, we're gonna require that as a qualification. We're paying $10 an hour. It's still going to be a qualification. I understood why they were doing that, right? They wanted to increase their qualifications to get the best candidates. But using a generic degree as a qualification did nothing for them, right? What assessments do is they align specific to the job, right? Through job analyses. You develop what is called criterion validity to be able to say, here are the criteria for this job, that these are valid measurements that we know we need for this job compared to this individual. So when we think about the concept of oral comprehension, there are all kinds of levels of oral comprehension. Think about the level of comprehension you need to be able to take a fast food order, right? You're at a window, you've got someone in their car, you can't hear it very well, but they're yelling into the speaker, I want this. Well, that's oral comprehension, right? Being able to hear and comprehend something that's being said orally. It's also oral comprehension to be a Supreme Court justice and to hear an argument before the Supreme Court. Those are both examples of oral comprehension, but at different levels. Well, what level do we need? We know for all jobs in America, we know the level, we know the answer to that, right? But what we don't do is apply that information to the actual individual, and assessments help us make that match. The other thing that we see in job postings all the time is this concept of critical thinking, right? And decision-making skills. And I always laugh when I see critical thinking on a job posting, because I think, well, what does that mean? Critical thinking, right? Like, all right, if I'm applying for a job, I'm gonna say in my resume and cover letter, I'm a strong and efficient critical thinker, because that's what I think they want to hear, right? But what the heck does that mean? What we can do through assessments is pull that apart, right? And be able to understand for each job, what does that look like? How do we know this stuff? Okay. If you don't know the website ONET, it's ONET online, onetonline.org. ONET Online needs to become your new best friend. Okay. It is the largest jobs database in the world. It is run by the US Department of Labor, the Bureau of Labor Statistics. This is the same bureau that puts out the monthly labor numbers, right? It says we grew this number of jobs last month. Our unemployment rate went down to this. That same bureau, they measure, or they have the largest jobs database in the world. Now, the shiny part of ONET is compensation. You can go on and you can see for any job that you can imagine, right? What's the average compensation nationally, by state, by metropolitan statistical area? They have growth trends, right, for every job. How many jobs are going to be added to this, or how many positions are going to be added in the next 10 years? Really cool data, okay, and shiny data. The real strength, though, and the underutilized strength of that database is the job analysis data that they have for every job in America, right? Think of a job, it's out there. Something like 950 jobs have been cataloged. So how do we know when we talk about assessments what we're measuring? Well, I've got 3 areas here that I'm going to show you for medical assistant. I typed in medical assistant, and here is on work styles, the data here. So look at stress tolerance, okay, right here in the middle of the image. This is a measure of how much stress tolerance do you need to have in this job. So the job requires accepting criticism and dealing calmly and effectively with high stress situations. Well, this measures at 88. This is a pretty stressful job, right? We want to know, when we are talking to a candidate, what is their level of stress tolerance? Right? That'd be pretty good to know. What is their level of cooperation? That's also at an 88. Let's look at abilities. So these are cognitive abilities. Okay, so oral comprehension is the highest ranked one. That's importance level is 75, right? Now, that makes sense to us, right? They're patient facing, right? So they got to be able to communicate, be able to hear what a patient is saying when they're doing their initial assessment of the patient, right? And getting the vitals and why'd you come in today, right? That's not surprising, but it tells us to what level does that individual need to have oral comprehension, right? How important is it? Now, look, deductive and inductive reasoning are right in the middle. So if we said on a job posting for medical assistants that it's really important for them to have high critical thinking skills, we would be lying, right? Because it's not saying it's not important, but it's not really important. There are a whole bunch of other measures that that is going to be I don't want to say far more important, but far more prominent, right, in that list of abilities for that individual. Let's look at work values. If we're looking at a medical assistant candidate, if they need a high level of independence, this is not the right job for them, because on this ranking, it's 39. Now, all of these rankings come from the actual labor market, right? These are not theoretical rankings. These come from the existing labor market, a whole bunch of surveys that are constantly refreshed, right, from the existing actual labor market to come up with this. All of this tells us, what are we looking for in candidates to the specific job, right? So when we talk about compensatory selection, when we integrate assessments, this gives us a whole bunch of evidence to be able to make decisions about an individual and their job fit. So let me pause there on the assessments piece and just, give me some feedback or any heartburn you have or anything on that. Okay, good. We got the ONET website up. Yep, thank you.
Yep, Stephen, I put that, I just wanted to mention that I put that in the chat. So still no questions, but I will
Cool.
monitor the chat.
Cool. Okay. Couple more things. So portfolios, as you use compensatory selection. So as part of a team where this was a health system that had like 55,000 applicants a year, 7,500 employees and 55,000 applicants. And they did roughly 4,000 new hires a year. So they had some significant turnover, right? They had some growth in there, but they had some significant turnover. what they realized in that process of 55,000 is they had to get from 55,000 down to about 5,000, 4 or 5,000 new hires. Well, that's a lot of work, right? And so they had a lot of things automated. And that's why they went to compensatory selection, because they knew they were kicking out a lot of people that they didn't want to kick out in that automated process. Well, one of the things that we built was this idea of a portfolio. This doesn't work in every position, right? You're not going to do this for at the provider level, but portfolios work really well with entry level positions, and they work really well with people who are new to healthcare. In this situation, what we did with the portfolio was, if you as a candidate completed the portfolio, and it was a package, it gave us a pretty close to final snapshot of what a compensatory selection process would give us, right? We had a really good view of that individual, lots of good evidence. If an individual completed a portfolio, they were guaranteed an interview. So they got to skip all of the steps that the automated process had individuals go through, and they got a guaranteed interview. Now, their interview to hire ratio was great. For every 14 people that they interviewed, they hired 10. So if you got a guaranteed interview by going through this process, you had a really good chance of getting a job. Why this worked is because that portfolio itself was the compensatory selection package, right? It gave that composite view because it had everything built in. We wanted the resume, we wanted the career pathway tracking, we wanted there was an interview prep process in there. There was a career coaching process in there. All of that stuff was built into the portfolio process. The other piece that made this work was the system partnered with a community agency to basically be their quality check on the portfolio process. So the community agency that was equally concerned about people getting access to these jobs said, we'll work with these individuals on these portfolios, get them in really good shape so that when they turn them in and the portfolio is complete, they get a guaranteed interview. So this is just one way to use those portfolios, or to build in compensatory selection, is through portfolios. It isn't going to work for every job, and you got to have a level of scale in order to be able to do this. But certainly if you've got a bunch of medical assistants or dental assistants that you're hiring each year, this is, these kind of processes can work. And then my bread and butter, the thing I'm most passionate about, career pathways, right? Compensatory selection is beautifully aligned with career pathways. So when you integrate or deploy career pathway strategies within an organization, it is just built in, right? It's part of career exploration. It's part of professional or credential development. It's part of mentorship. It's part of assessments. All of those, you need to have all of those built into both, right? And when you do that, what you allow yourself as an employer, as a center or an organization to be able to do is to transition. Yes, you're on a career pathway process right now, but here's an opening, right? We can build in our compensatory selection processes so that you can slide right into this opening, right? The work is already done. All right, so some final thoughts on this, right? Compensatory selection is going to help organizations know more about their candidates, right? It just gives you better and more useful information. It's going to help candidates put forth a better view of themselves to employers. It kind of takes the pressure off. Now, most candidates who go through this wouldn't know that they're in a compensatory selection process, but if they did, the pressure is relieved, right? And they can just be themselves. Helps reduce the risk of bias, whether it's implicit or not. Facilitates the use of evidence-based tools. Ultimately, it's going to lead to job fit. So let me pause there and end there with formal slides, but this is very much a high-level view. Let me also qualify and say, if you're going to do changes to your hiring process or recommend changes to hiring process through this kind of work, you need to have your labor lawyer involved in this, right? And making sure that you're doing it the right way. That just gives everybody a level of ease. But this is a workable process. There's more work up front to get it started, right? And to get people and candidates through this. But all the evidence in the world tells us that compensatory selection leads to better job fit, which leads to better retention, which leads to higher engagement, all of that, right? So what you deal less with on the other end is your turnover, right? We, in the scenario I've talked about a couple of times with this health system, went through a process where the turnover was in the mid 30s. And 2 years into this process, compensatory selection, they got turnover down to about 13%. And it's because this process was not only finding better candidates, right? We had evidence to tell us that, but also the level of engagement from day one because of this process. People had buy-in, right, in their organization much quicker than before.
And Stephen, we
Yeah.
have a comment in the chat. I'm just trying to turn my camera back on. There we go. Again, everybody, I apologize for any background noise. I'm actually in the middle of a travel, work travel and event. But someone said the information provided has been most valuable as it relates to reducing bias and streamlining processes. So definitely a lot of people enjoying this. And I actually had a question, if it's okay with you.
Sure.
I was thinking about this because when we do some of the trainings, one of the things that comes up with some health centers is not really knowing yet or just starting to develop their organizational culture and their values, things like that. So I know you talked a lot about work values and that alignment. How difficult would it be to do that compensatory selection without really knowing yourself and your organization and your culture?
Yeah. So, I mean, I think in theory it can be done because whether you know the culture or not, the culture exists, right? And it's culture is, period. Now, what do we know about it, right? And how aware of it are we? Um, so let me differentiate. When I say like work values, that's a very specific definition, right? Of an individual's values as they approach work, right? And sort of what drives them, what doesn't drive them, what motivates them. But I think, this won't work as well if the organizational culture isn't well communicated, right? And well understood. Because if you're going to make decisions about, right, the meaning of teamwork and how we hire, because you might come to, if I go back to um, so work styles, you may come to a decision as an organization about initiative. Let's pretend this level of initiative was at a 40 for this job, but you may decide, yeah, a 40, importance level of 40 is only what's needed, but we're only going to hire people that score a level 70, right? Which is as long as it's not providing or creating adverse impact, right? A legal definition for subgroups, that is at the discretion of the organization to create that, right? So all of this stuff is your guide to being able to understand, um, you know, how does an individual measure up? It is not to say if they meet all these that they then are the right candidate, because not what we've said the whole time is not one thing is going to make someone the right candidate and not one thing is going to make them the wrong candidate, right? We're taking the whole view. So as an organization, you get to decide what are those qualities that are most important to us. Well, it's hard to decide that if you don't know and communicate what the culture is, right? So I think that's all of that is so well integrated, right? And it requires a much more thoughtful approach to hiring than the automated process, right? It's kind of why I worry about what AI is going to do in hiring, because AI should be there to help us, not replace us. And I worry about us taking the human factor out of it, not the bias piece, right? We want to get that out of it, but the human factor of sort of the connection that we can make with candidates through all of this evidence. Does that answer your question? Or am I?
Yeah, no, that
Okay.
was great. That it answers the question, absolutely. And I'm glad that you mentioned that with AI, because also people, just reminding people, AI has a huge amount of bias because it's coming from the data that humans are putting out
Right,
there.
right.
So this idea that it doesn't have that, you need to have that human aspect to it to ensure that
100%.
that's not being put in there. Stephen, I am not seeing any questions in the chat. I don't know if
Cool.
anybody has any final questions in these last few minutes, so feel free to go ahead and put them in the chat. Just in the meantime, I just wanted to tell everyone, oh, and thank you, Stephen. Stephen put his email in the chat so you can contact him. We also will be putting up an evaluation in just a moment, so Mariah will have it pop up on the screen. We will send the slides to everyone, and just so you know, we also have a few outro slides, but I wasn't gonna have them come up, but basically we just offer extra resources. Everything is hyperlinked on there. And then I also just wanted to say thank you so much, Stephen. This was absolutely amazing. You know that we feel so honored to have you here. So just really appreciate the knowledge that you bring to today's session and just in general.
Well, thank you. And likewise, same sentiments. So
Thank you.
great to be here for sure.
Thank you. And for everyone, thank you so much for joining us. We'll give you about 2 minutes back. We'll leave the room open to make sure everyone's able to fill out the evaluation. And then of course, if you have any other questions, just let us know.